How much does a meal cost? There's a monetary value, but apart from that, what other factors affect the access which someone has to getting nutritious food? For many people, getting a meal isn't as easy as picking up from the grocery aisle. So when money is tight and times are tough, what is the real price that families pay to get food on the table? In Alabama, many low-income families have to decide between eating and other essential payments, such as for electricity or car repair or going to the doctor. Of Alabama families who relied on food pantries and food assistance, 74% had to decide between medicine and food, 66% between transportation and food, 66% between utilities and food, and 51% between housing and food. Dilemmas such as these paint the picture of what it's like to tackle the issue of nutritional insecurity, a crisis which over 120,000 people living in Jefferson County face on a daily basis, 33,000 of these being children. As one's income and access to nutritious foods are inherently linked, families living in poverty face the greatest threat to their nutrition. Federal aid and nonprofit organizations such as SNAP and food banks help to minimize these struggles. Analyzing and understanding these keystone programs and services provides the most accurate depiction of the city's current food security ecosystem. SNAP, which stands for the Supplemental Nutrition Assistance Program, is a federal service designed to minimize the cost of food by providing individuals living in poverty with meal subsidies. Formerly known as the Food Stamp Program, SNAP is the nation's largest provider of meals to families, supplementing tens of millions of dollars to its participants. The eligibility of recipients was increased in 2002 to include resident immigrants, a demographic which accounts for the largest percentage of impoverished communities in Alabama. The average SNAP person receives about $126 a month, allowing for only $1.40 per meal. This lack in reliable funding explains why so many individuals who receive SNAP also depend on food pantries to fill the void in their diet. These circumstances create a conflicting situation. Between quality and quantity, 87% of people who rely on food assistance or food pantries have chosen to purchase inexpensive or unhealthy foods to get by in the last weeks of the month. Food banks are an essential component to supplying these families with sufficient nutrition, providing local pantries with large quantities of food. Located in Birmingham, the Community Food Bank of Central Alabama works with over 230 agencies to form a network of support for these families in need. They provide a structure of reliable donations for these pantries located throughout Jefferson County. I reached out to the Community Food Bank of Central Alabama to ask their perspective on Birmingham's food insecurity as well as the contributions they have done to help solve this problem.
So my name is Aoife Dowd, and my role here at the food bank is I'm a Child Hunger Corps member.
She explains to me the larger pivotal role which food banks play in our city's large-scale food availability.
The way that system works is we, buy things wholesale from distributors. Because we're a 501c3 nonprofit, we're able to, get those items without tax. We're able to purchase big scale items because we have the capacity to do that. And then we're able to hand those prices off to our agencies.
Altogether, the food bank is able to provide annually over 10 million meals to its agencies. Having such a strong impact on the community, the food bank is well aware of the part they play when it comes to their nutritional standards.
So we have some folks on staff. We've had a lot of dietetic interns come in, do a lot of work with us, trying to do some education around purchasing items that are lower in sodium, that might have lower sugar content, that maybe don't have as many trans fats in them, because just food insecurity as a concept is linked not just to the amount of food that a person is able to consume or it has access to, but the quality of the food. So assuming that people are accessing food pantries, they're accessing our services a little bit more regularly than I think the original intention of food banking was. There is that thought of how do we step in as not just good stewards of our food and good stewards of our community, but also as a organization that is now impacting people in their daily lives and is almost more of a public health organization in some capacities.
Supplying these communities with healthy options like fresh produce comes with added responsibility.
You know, we have an obligation to make sure that that's being stored properly, that it's going out to the community properly. And so, do they have refrigerators? Do they have the space to store fresh produce? Do they know how to handle it? Do they have the volunteers to clean it and wash it? Refrigerators. One thing that we've been able to do is kind of just-in-time delivery models. And so, when we were first doing our big push with produce, we worked with some initial partners who were able to kind of get the produce on site one day and then get it out all in the same day to their community. So they didn't have to worry about refrigerating it. They didn't have to worry about saving it. Then we also do have our backpack program, which goes home in the backpacks of kids. So kids who unfortunately receive the majority of their meals during the school week are able to receive a backpack, small bag, food pack kit. It's all easy to open, pop-top stuff so kids can prepare it themselves. And those are kind of discreetly put into their backpacks on Fridays before they go home for the weekend.
The unfortunate reality is that many people will continue to go hungry as a result of poor economic conditions. Current social systems provide reliable support, but there is still more work to be done. It is now more important than ever for cities like Birmingham to stand united against hunger. Please donate to your local food pantries.